How are we doing, guys? Mr. Striz. Today's LEQ is identify various factors that affect blood flow. So we're going to look at the circulatory system today, and we're also going to look at some diseases that affect blood flow, how they affect blood flow, and what causes them. But first, we have to know about that circulatory system. So the circulatory system is an organ system that allows blood to circulate and transports nutrients to and from the cells in the body. So if you notice this picture here, you obviously have the main organ of the heart within the circulatory system, and you have these blue and red. Those are going to be arteries and veins, and we're going to talk about arteries and veins next. But the circulatory system, it's very important because it's all about blood flow. So we're going to look at how, first we're going to look at how that blood flows within the heart and to the different parts of your body, and then different heart diseases that can affect that blood flow. So when we move into arteries are a blood vessel. Arteries is a blood vessel that carries blood away from the heart. So arteries carry blood away. So that's why, when you nick an artery, you always see it in cop shows or TV shows where someone's bleeding out because they nicked an artery. It's carrying that blood away from the heart. So that's why people can bleed out very quickly, because all that blood is supposed to be traveling to an area that's not going to anymore because that artery has been cut or nicked or anything like that. So arteries carry blood away from the heart, whereas the difference is with veins. So looking at veins are blood vessels that carry blood toward the heart. So we see, if you're looking at your arm right now, you could probably see different veins within your body as you see, the vein picture here. These are all veins that travel throughout the arm. So veins carry the deoxygenated blood, so blood that does not have oxygen, back towards the heart so it can get more oxygen. Whereas arteries, if you go back here, this picture, these are all major arteries that carry blood away from the heart there. So if you notice, you got all these, that's your arteries on your neck, the arteries in the leg, the arms. Those are major arteries, once again, that you don't want to be cut because you can bleed out very quickly. So veins, once again, they're blood vessels that carry blood toward the heart. Now I got a quick animation here that shows you how the blood actually flows into the heart and away from the heart.
Now, you have seen the structure of the heart. Let us find out how it works. The blood becomes oxygen-rich by absorbing oxygen in the lungs. The function of the heart starts when oxygenated blood is carried from the lungs to the left atrium of the heart by means of the pulmonary veins. The left atrium relaxes. This blood is pumped into the heart. When the left atrium contracts, the left ventricle relaxes simultaneously. The left atrium pushes the blood into the left ventricle through the one-way valve. When the left ventricle contracts, the blood is pumped into the aorta, which carries oxygenated blood to the different parts of the body, except the lungs. Oxygenated blood reaches the different parts of the body through the blood vessels called the arteries. The arteries gets branched into capillaries, which then reaches to the different organs of the body. The blood then becomes deoxygenated, and the blood capillaries gets mixed and form thicker blood vessels called the veins. The veins carry deoxygenated blood to the heart. The blood vessels that carry deoxygenated blood to heart are known as the vena cava. The deoxygenated blood from different parts of body enters the upper right chamber of the heart, which is called the right atrium. The right atrium gets contracted, allowing the blood to flow into the right ventricle, which contracts with the expansion of the right atrium through the one-way valve. The right ventricle then contracts, pushing the blood into the pulmonary artery.
So that was just a real quick animation that shows how that blood flow, on that left side of the heart, your blood flows leaving the heart, where it's going into the arteries to bring blood to the different parts of your body, whereas on the right side of your heart, that's when the veins bring back that deoxygenated blood back into the heart to be oxygenated again by the lungs. So it's a very, important organ system and very cool organ system in the sense that, it's the main reason why you're alive, but how it actually works, with that left side pumping blood out, that right side bringing blood back in so it can be oxygenated one more time. So we don't have to know about blood pressure. I'm sure you guys seen these before when you go to a doctor, but they're checking for blood pressure. So blood pressure is the pressure of circulating blood on the walls of blood vessels. So it's basically how hard your heart is working. So, your heart is working very hard every day, but the more it works, the more stress you put on yourself, the higher that blood pressure is, which is not good because it can lead to stuff like hypertension, which is basically high blood pressure. And then high blood pressure can lead to different other heart diseases as well. But once again, that blood pressure is the pressure of circulating blood on the walls of the blood vessel. So how hard that your heart is actually working. Now go into exercise. So it's very important to know that exercise reduces the chance of heart disease by allowing increasing blood flow to the muscles and allows you to receive more oxygen. So they always talk about, physical education, why PE is in the curriculum and everything like that because of the benefits of exercise. When you exercise, you're increasing that heart, you're working that heart. The heart is a muscle, so it increases the blood flow, to the muscles and allows you to receive more oxygen. So it helps reduce chances of getting heart disease that you'll see in these next couple of slides. So moving on to the next part. So the first thing we're going to be talking about is atherosclerosis. So what atherosclerosis is, it affects blood flow by causing arteries to stiffen because of plaque buildup. So notice here, this is a normal function of the arteries. Now notice over time you get this plaque formation. So this plaque formation decreases the amount of blood that is transporting through those arteries, and it makes the heart work more than it needs to. So the symptoms are chest pain, and then it's caused usually by a bad diet. Sometimes, it could be more hereditary, but usually it's a bad diet because you're eating all these fatty foods. That fatty foods leads to that plaque buildup, and that plaque buildup can end up leading to, a heart attack or hypertension, anything like that, where that heart is working harder. But I have a video that shows atherosclerosis building up within one of your arteries.
It's called plaques. These plaques are made up of cholesterol and inflammatory materials. This disease process is called atherosclerosis, and it can occur in any artery in your body. Atherosclerotic plaques build up over time and can decrease the amount of blood flow to the area the artery supplies. Atherosclerosis can begin at a young age, even though it may not cause problems until years later. Atherosclerosis increases the risk of kidney failure, heart disease, and stroke.
So as you see there, atherosclerosis is a very, important heart disease that can be very harmful because of the different things that it can cause. As you saw there at the end of the video, kidney failure, heart disease, and stroke. And we're actually going to look at stroke a little bit later in this video. But once again, it talked about cholesterol. So high cholesterol. High cholesterol is caused by eating, a lot of foods that are high in fat or sugar, anything like that. So atherosclerosis, remember, it causes arteries to stiffen because of plaque buildup. And moving on to the next one. So the next one here is a stroke. It's caused by a blocked artery or leaking of a blood vessel. Symptoms, dizziness, numbness, or headaches caused by blood clots. So these blood clots can do two different things. That's a blocked artery, or the leaking of a blood vessel is basically what happens is the blood vessel actually ruptures, and it ruptures open. And then so that blood is then, instead of going into artery, it goes into your brain, and that's called a hemorrhage. A hemorrhage is basically bleeding of the brain, but I have a video here that shows that going on with inside the brain.
Can be encouraged to take over. Ischemic stroke. This happens when a clot blocks an artery that carries blood to the brain. It may be caused by a blood clot, which has formed in the main artery to the brain, a blockage caused by a blood clot, air bubble, or fatty lump forms in a blood vessel somewhere in the body and is carried in the bloodstream to the brain. A blockage in the tiny blood vessels in the brain. Hemorrhagic stroke. This happens when there is a rupture of a blood vessel in the brain. It may be caused by a blood vessel which bursts inside the brain, a blood vessel which bursts on the surface of the brain and bleeds into the area between the brain and the skull.
So as you saw that, the stroke is a very dangerous issue. Once again, that's two different types where it's caused by a blocked artery, which could be caused by that blood clot like shown in the video, or a leaking of a blood vessel, which we saw there, where it's the rupture of a blood vessel, and that blood is actually, then going around the skull or into the brain. So it causes that dizziness, numbness, or headaches, and then once again caused by blood clots. So once again, strokes though, there are issues caused by, leads to by bad diets, that hypertension, other heart disease that can lead to a fatal stroke. And the last one we're talking about today is high blood pressure. So high blood pressure affects blood flow. How? It's increased pressure in the blood vessels. There's no real symptoms. So high blood pressure, and it's similar to hypotension, is basically a silent killer because there's no real symptoms of high blood pressure unless, you see that your blood pressure is high when you get tested by the doctor. So it's caused by not exercising, hereditary, or bad diet. So there's a lot of different things that can lead to high blood pressure. Remember, high blood pressure kind of leads to all the rest. So it's high blood pressure, which can lead to atherosclerosis, can lead to strokes. It can lead to different heart diseases. It all starts with that high blood pressure. And once again, we talked about exercising, how it's good for the body and good for the health. So not exercising will be bad because you have all that fat buildup, that sugar, that your body's not using. Hereditary, sometimes people just have high blood pressure based because of their mom and dad. And then once again, caused by that bad diet. So those are 3 different factors that affect blood flow. This is Mr. Striz signing out.